Welcome to Season 2 of Talk Me Healthy. Each month, we invite a guest to explore a topic related to healthy living. They share their expertise, personal stories, and we learn from them how they turned their passion and knowledge into practical tips that you can use now to improve your health. I'm your host, Sherrie Keating, founder of Diabetes Care Consulting. My goal is that you will hear something each show that will motivate you to make a small change towards living a healthier, happier life. Hello and welcome to Talk Me Healthy. My name is Sherrie Keating, your host. Today's show, we're going to talk about a new hope for depression. Depression actually affects 15 million adults living in the United States, and there is a newer FDA-approved treatment called transcranial magnetic stimulation, or TMS. So I've invited two guests today to give us education on this and their new center in Leominster. So welcome, Dr. Rebecca Knapp, who is board certified in adult, children, and adolescent psychiatry and has been practicing over 25 years in this field of behavioral health. And then Marjorie Pierce, who is the Director of Operations at Achieve TMS East in Leominster. And you are a licensed independent clinical social worker with over 20 years experience in the field. So welcome.
Thank you for having us.
Thank you so much for being here. And this is such a great opportunity to educate people on this newer treatment, as you explained to me earlier. So tell me a little bit about yourselves and how you became interested in this field. Who wants to go first?
In the field of psychiatry or in TMS?
Both.
So probably my interest in psychiatry dates back to before I even thought about medical school, working in Appalachia with a team of people that was going into rural Appalachia to provide health care services. And the number of people that I met during that time who were severely depressed and not getting treatment really struck me. So I think I carried that with me to medical school and became interested in psychiatry during my training. I've got a lot of psychiatrists in my family. Sometimes it's called an inherited disease in my family, a psychiatrist. But once I went into psychiatry, anyone who's been in the field for any period of time finds that there are some people they just, despite their best efforts, can't help that much. That the depression is really stubborn and persistent despite all the available treatments and the patient's best efforts. And so when Margie contacted me to see if I might be interested in learning about TMS and maybe coming on with Achieve TMS East, I think the idea that we might be able to help this really resistant population appealed to me tremendously, because the patients that I can help move on with their lives, and those that I can't help so much stay, and it ends up feeling more like I'm holding their hand and saying, I'm so sorry, I can't do more for you. And TMS has really changed that whole equation.
I can't wait to hear about it. That's wonderful. And how about you, Marjorie?
I would say I became interested in getting into the social work field. Both my father was a school counselor for many years, and so there is the family sort of connection to helping. And then my involvement also in similar service work, and just feeling like there's a lot of people out there that need help and need people who are caring, compassionate people trying to make a difference in their life and change their lives. And so that's how I pursued the field of social work. As far as getting involved with TMS, I was introduced to it by a friend of mine who's one of the owners of the company, and I wanted to be in more of a leadership role, but still be doing something that sort of was part of my value system. And so working with people with treatment-resistant depression was a way of me continuing to do the work that I had been doing, but on a greater scale and from more of a leadership perspective versus a direct care perspective. And being able to see the benefits we're providing to people has been really inspiring.
That's wonderful. Well, I'm sure your patients appreciate all of your experience and what you're doing to help them. So, depression. I personally suffered from depression when I had cancer. It was a situational depression that I went for treatment and took some medications for. And when that situation was resolved, I moved on with my life. But that isn't so for some people.
That's right.
So can you tell us a little bit about depression and the different types of depression, and what type of candidate or person would benefit from this TMS treatment?
Okay. So you've already made the distinction between situational depression and a more biologically based depression. So some people have depression that's a result of stresses in their lives or circumstances, and we call that situational depression. All of us are prone to something, right? So under stress, we're all tipped into something that could be anxiety, could be insomnia, could be overeating, could be any number of things. But many of us, if we're under enough stress, get tipped into a depression. And sometimes that depression will lift once the circumstances change or the stress disappears. Sometimes it doesn't. And sometimes, regardless of whether it's a result of circumstances or not, it can be severe enough to really disrupt functioning and disrupt lives. So if I see a patient whose depressive symptoms are severe enough to really derail their life, especially in more than one setting, then it's reasonable to consider treatment for them. Some people develop depression out of the blue. They have really no reason to become depressed, and they'll say, my life is great, my life is good, I have no reason to be depressed, I can't be depressed, and yet they have these symptoms that have just really come out of nowhere, and the same thing happens. They're not able to function as well. Their relationships become strained or affected. They are not themselves, and sometimes the effects of that are really devastating, personally, but also families suffer as well.
Absolutely.
So those are sort of the two main types. The seasonal affective disorder, the seasonal depression, I think of as sort of a subtype of situational depression, the situation being winter and low light.
Which we all had this year, right?
Yeah, boy.
Seasonal depression, all of us, until recently.
Yeah, I know. So that's how I think of
Okay.
it.
And so when people have depression, there's different treatment options. And would this be at the top of the list, this TMS, or would this be after other treatments have been ineffective, or would you just go right to this treatment?
Well, I would love to go right to it because I think there are a lot of advantages to using a treatment that doesn't have the kind of side effects that medications often have. But it's FDA approved right now only for treatment-resistant depression, and that means somebody who has, there are different definitions by different insurance companies, but essentially it's failing 4 antidepressants while engaging in therapy that's shown to be effective for depression. So cognitive behavioral therapy or various other types of psychotherapy. So if you meet criteria for the treatment-resistant depression, then insurance companies will cover the cost of TMS.
They have to fail 4 treatments before they can have this? Wow.
Yeah, which is tough. I mean, you think
Yes.
of each time you fail a medication, how discouraging that is.
Right.
Your hope for future success goes down, and the data is really clear that with each subsequent med trial, your chances of going into remission from depression drop significantly. So by the time you've tried 4 medications, the chances that you're going to respond to a 5th are somewhere around 5-6%.
Wow.
Whereas the deep TMS that we do at Achieve, that number then jumps to about 75%. So it's
amazing.
a dramatic increase in the response rate.
So tell me about this deep TMS.
You
Marjorie?
want to describe it?
Well, there's 2 kinds of TMS. There's surface TMS and there's deep TMS. And basically it's a different machine that's used. With the deep TMS, we use a helmet that has a coil in the helmet that is what's actually providing the magnetic pulses that are penetrating into the brain and stimulating the brain. With surface TMS, they're using more of what's like a plate that sort of rests on the same sort of area we're targeting, but it only targets that one place. And the main distinction is that the surface TMS penetrates about 2 centimeters into the brain, where the deep TMS covers a wider range and it penetrates closer to 5 to 6 centimeters. And then in the FDA studies that were done both for surface TMS and for deep TMS, and it wasn't a head-to-head study, they were individual studies, the efficacy in the FDA study for deep TMS was significantly higher than that for surface TMS.
So I am a patient that I failed 4 medical treatment options. And so now I'm a candidate for this. Where do I go? Who do I call? How do I find out about this? And then what happens when I get an appointment? What's the process? Will you take us through the process?
Sure. So generally how people come to us, it could be through a referral from a provider, a primary care doctor, a therapist, psychiatrist. It could be from a former patient who had treatment. It can be something that's found through social media because we advertise. So a patient can call themselves without a specific referral from a provider. And generally speaking, we will screen them in the beginning just to get a sense of, are they diagnosed with major depression? Have they had medication trials? Are they in active treatment currently with providers, even if they haven't been referred by a provider? Because that's an important part of our treatment, is that even while they're doing treatment with us, that they have a therapist and either a primary care or a psychiatrist who's monitoring their medications.
Do they still stay on medications when they start this treatment?
Yeah, they generally
okay.
do. They generally do. We encourage patients to stay on the medicines that they're on during treatment. And if their depression improves significantly or they go into complete remission, oftentimes after the treatment is done, they start tapering off those medications. So sometimes at the 2-month mark, we always have them come back at 2 weeks and then at 2 months to follow up and see how they're doing. Many of the patients that I've seen have come back on either next to no medications or no medications at all because they've continued to taper off the medicines that they came in on.
That's wonderful.
So that's been really nice to see.
Wow.
The other thing I was going to mention about the 4 medication trials, it doesn't have to be that they've had a trial and not responded to the medication. Sometimes people will respond to the medication but have such unpleasant side effects that they just can't tolerate staying on it. So, the definition of an adequate medication trial is 6 weeks at a therapeutic dose. But if you're having horrible side effects, some people might be on for a few days or a few weeks and just say, I can't, whatever side effects they're suffering are just intolerable. So that counts as a failed medication trial.
So that would get them into quicker.
Right.
Because I was thinking 4 medication trials, that could take a long period of time.
Right.
So
Right.
the average time frame would be what? Maybe a year, 6 months for that process to happen in order for them to qualify for this, do you think? Or is it
Yeah,
different for
Potentially, it
everybody?
would depend. Yeah.
Yeah.
It depends
Yeah.
a lot. I mean,
Okay.
many of the patients we see have suffered from depression for years, even decades, with more med trials than I can count, you know. And some are newer to depression and newer to treatment and have had, 4 medication trials in the last year.
Okay. All right. So someone gets referred.
Right.
They come to the office.
And they would come in for a free 30-minute info session with one of our technicians who would gather a little bit of information from them, show them the machine, talk to them about TMS, answer their questions. Assuming that the person wanted to move forward with treatment and the technician didn't have any concerns from that meeting, they would move forward to the next step, which would be to meet with the psychiatrist. And then the psychiatrist would do a full evaluation to determine that they do meet the criteria for depression and they have the antidepressant failures and that there aren't any other contraindications to moving forward with the treatment. And assuming that all goes well, then the insurance company, we would get a prior auth from the insurance company if the person needs that. And then once the insurance has approved it, we would move forward with the next steps of treatment.
So insurance covers this?
Yes, all insurances, all commercial and Medicaid products and Medicare.
Okay. For the diagnosis of major depression.
Yes.
Treatment-resistant major depression. Right.
Resistant. Okay. Yeah. All right. So now my insurance has covered it. So now what's the next step?
So they've covered it, and now you would go in for your cortical mapping with the doctor, and I'll let you take over here.
Sure. So in the first visit, we do what's called cortical mapping, and that's to figure out just the right position of the helmet so that we're targeting the left prefrontal cortex, the part of the brain that is not functioning well with depression.
Okay.
So the tech fits a felt cap onto the patient's head that they use for the duration of the treatment and places measuring tapes front to back, side to side. We take some measurements and make some calculations and figure out the initial placement of the helmet. And then I pass a single magnetic pulse through the patient's brain, and with their hands relaxed on their lap, look for just a twitch, a motor twitch, just a little twitch of the muscles of the fingers and the thumb. And I move the helmet methodically 1 centimeter at a time, front to back and side to side, and look for the best movement, really looking for the index finger and the thumb to move more vigorously in one position than another, and that's how we know we're in the right
part of
spot.
the brain. Oh, fascinating.
And then the tech makes some other calculations and finds the final coordinates for this helmet. And then we measure something called the motor threshold, which is the least amount of power that elicits a response. And that determines the power setting for the machine where we start treatment. And we gradually ramp up the power early on in treatment to get to about 120% of what that motor threshold value is. And the cortical mapping takes maybe half an hour, and then we do the first treatment that day.
And how long do the treatments take, and how many treatments does a person have?
The treatments take about 20 minutes on average. And so they, when they come in for their treatments, they might spend some time filling out rating scales, but they can count on about a half an hour door to door. And it's an intensive treatment in that it's 5 days a week for 6 weeks, and then we have 3 weeks of 2 treatments a week as a taper. Mm-hmm. That's kind of the standard treatment. Okay. So if you think of it as an alternative to ECT,
I was
electroconvulsive
going to ask you
therapy.
about what's the difference between that and
Yeah.
ECT. You usually have to be in the hospital, right?
Right. It's done in the hospital. You have to be under general anesthesia. They induce a seizure while paralyzing your body, so your muscles aren't contracting. So there are risks to general anesthesia, and there are a lot of side effects, particularly memory loss. A lot of people suffer memory loss from ECT, also pretty severe headaches, and you have to recover from the anesthesia after each treatment. So there are times that it's absolutely life-saving, but if they can respond to TMS before having to go for ECT, most patients would prefer being able to drive themselves to and from appointments, not have the kind of side effects that they risk with ECT.
Are there any side effects from this?
Mild. There are times that people will complain of, say, mild headache, usually taken care of by Tylenol or Motrin. Sometimes fatigue. I've had some patients have a little more trouble sleeping, especially in the beginning of treatment. And most of those side effects seem to sort of fade out in the first week or two.
And so after the initial period, it's 4 to 6 weeks of treatments?
It's about 6
weeks?
Yeah, 6 weeks. So
About
30
treatments?
30 treatments.
And
right.
then what's the follow-up? You wean them they come in twice a week. Does that include the twice a week?
It's 36 treatments altogether
Okay.
for the standard protocol.
Okay.
And then we see patients 2 weeks after treatment.
Okay.
They come in and see me and talk about how they're doing. And then again at 2 months. And sometimes patients continue to improve. It sets in motion some recovery that continues after the treatment ends. So sometimes I've really been impressed by how much better a patient is 2 months after treatment than they were even at the end of treatment.
So, and are they in remission forever, or do they need to come in for like a yearly follow-up, or what have you seen?
Yeah. So the data that we have is that most patients don't have to return. It's a single treatment. So around 68-70% is what the data is looking like for patients that don't need to come back for treatment. Of that 30% or so that relapse, we bring them back for more treatment. Sometimes 8 or 10 booster sessions is all they need to bring them back to baseline. Sometimes they need to repeat the treatment. So we're talking a lot these days about, how do we prevent relapse? If somebody responds to a medication, we don't stop it in 6 weeks. We continue it. And ECT has a model for maintenance treatment. So we're talking a lot now within Achieve about, for people who have a real demonstrated history of relapse, do we want to be thinking about maybe having them continue for 1 or 2 sessions a week for a longer period of time, maybe 6 months, maybe a year. So we're working on figuring that out.
Well, this is life-changing. I mean, it must make you guys so excited just for your patients. I mean, they become functional and able to hold down a job, their quality of life. I mean, I can just remember where I was at that time when I had that situation of depression and I developed panic attacks, anxiety, and how debilitating it was just to get up every day and face the day. Like, this is just like, these patients must just be so excited that they've been given a second chance at life.
Right.
It must just be awesome.
Right. Yeah.
And for you guys to see the effects.
Yeah, it is. It's pretty amazing.
And is this being used everywhere across the United States, or just select places, or does everyone have the opportunity to have this treatment?
Well, it's spreading.
Yeah, it's definitely, you're seeing more treatment, centers or doctors who are buying machines of all the different brands. So yeah, throughout the country, there's areas where it's obviously more widespread than other places. But yes,
That's wonderful. And do you think this technology can be used for other medical conditions in the future?
One of the other reasons that I decided to do this is that there is so much promise for treating other things for the future. TMS has been used for a lot longer in Europe, over 20 years. And in Europe, they're using it for anxiety disorders of different kinds, post-traumatic stress disorder, addiction disorders. In this country, we're on the verge of getting FDA approval for treatment-resistant OCD, obsessive-compulsive disorder, which causes just terrible suffering for the patients afflicted by that. So we're hoping this summer we'll be getting a different helmet that's configured to target the right side of the brain and start and get trained in how to treat resistant OCD.
So the helmet is the key.
Yeah.
So there's a different helmet for each medical condition?
Well, I think
It varies.
Yeah.
It varies. But I think that's a big distinction between us and the companies that do the surface TMS.
Okay.
Because aside from the efficacy for depression, we're also going to be expanding in treating other disorders as well. There's research being done in the U.S. currently on PTSD as well. So, and I believe on smoking cessation. So there's a lot of options and a lot of hope for other disorders as well.
Boy, this is unbelievable. This is so good. I'm so happy that you guys came on the show because this is going to help so many people. And I can see your passion and your excitement about how well this is working for patients. So tell us a little bit about Achieve TMS. We have a couple more minutes, so I want to get the information out because if there's anyone out there who really feels they could benefit from this, I want to get the information to them. So tell us how to, we'll have all the contact information, but where is your office located in Leominster?
So our office in Leominster is actually located right behind Leominster Hospital.
Okay.
50 Memorial Drive.
Okay,
Right.
50 Memorial Drive. And we're going to have the phone number so we won't make you.
Right.
We're going to put the phone number on the show and we'll have the contact information to make the appointment to be screened to see if you qualify.
We also have sites throughout Massachusetts, and I think that's important to know because even if we're targeting this area right now, people know people throughout the state. So right now we have 11 total sites, 6 in Western Mass, and then we're in Leominster, we're in Westboro, Worcester, we're in Quincy and Plymouth, and about to open in Newton. And then in Western Mass, we're in Northampton, Holyoke, Springfield, Amherst, and North Adams. So we're in lots of different places, and we're going to continue to grow in Massachusetts and likely into Connecticut because you have to come to it every day. We want to make it accessible for people. And wherever we set up sites, we always make sure we're on public transportation routes so that if transportation is an issue for people, they have the option to take public transportation as well.
That's awesome. So you're really going to change the lives of many, many people. Congratulations.
Thank you.
That is wonderful.
Thanks.
And thank you so much for coming on and telling us about this new hope for depression.
Yeah. Thanks
You're
for
welcome.
having us.
Thanks
I
for having
can't
us.
wait to follow up and hear more success stories. It's
Yeah.
wonderful.
Yeah,
absolutely.
So I know our show time is over, but it's been a pleasure to have you.
Thank
you,
you. Thanks
Dr.
so much.
Knapp and
Thank you.
Marjorie.
Yeah.
And please, if you feel like you are a candidate for this, please contact Achieve TMS East, or we will have, is there a main number so that they can get connected to any of the places that you have in Massachusetts? Okay, we're going to have the main number and the local number. And so our next show, stay tuned. Next month, we're going to be actually having a personal story of somebody who actually had a rare eye disease and that led to blindness. And she's going to be telling us her story and that she started a company to help people with vision impairment. So stay tuned for that next month. But until then, this is Sherrie Keating. Remember to live your best life every day starting today. Thank you for tuning in.